I'm happy to meet you today. I am very thankful for dear Professor Dr. Ines for her kind invitation for me and for Novartis company for her kind invitation and her active participation in this great conference. Do diabetic patients benefit more from the early combination strategy? How can Verify change your patient's life? Reimagining diabetes standard of care. This will be our talk today. Our agenda will include Verify trial overview, further analysis and numbers for the patients who benefit more from the dual combination strategy, the American and European Guidelines 2020 updated consensus report, a new publication, sub-analysis of the Verify study. It is time to act. This is the consensus. Patients with type 2 diabetes cannot buy back time, but you can help. Despite the suboptimal glycemic control, physicians typically delay treatment intensification. This is the previous concept. For the uncontrolled patients, guidelines recommended earlier treatment intensification to help. This can achieve and maintain earlier glycemic control, improve long-term outcomes, and reduce the risk of future complications. This is the concept. Pharmacological approach for management of type 2 diabetes mellitus. Drugs in combination to act on the multiple pathophysiological defects. Treatment targeting the pathogenic abnormalities and not simply reducing hemoglobin A1c. Early treatment intensification to prevent or slow the decline of beta cell function. The early combination therapy as a strategic approach synergistically tackle multiple pathophysiological mechanisms, potentially resulting in more durable treatment without increasing the risk of adverse events, which is very important. Here, the combination, the perfect combination between vildagliptin and metformin acts on key underlying defects of type 2 diabetes. As you know, metformin will act on insulin resistance, while the glucose-dependent mode of action of galvus targets both alpha and beta cells of pancreas. Beta cells, it will increase insulin secretion. Alpha cells, it will decrease glucagon secretion. Galvus or vildagliptin has established safety profile. It has fewer hypoglycemic effects. It has weight neutrality. It doesn't increase the body weight. It has good tolerability and overall cardiovascular safety. Galvus, the time is now. Why the time is now in Galvus? Because it delivers powerful hemoglobin A1c reduction. It has established safety profile, as we have mentioned previously, with no increased risk of hypoglycemia, weight reduction, weight neutrality, good tolerability, and well-documented cardiovascular safety. And it has a glucose-dependent mode of action that complements metformin. So Verify came in order to establish this concept. Glycemic durability of an early combination of therapy with vildagliptin and metformin versus sequential metformin monotherapy in newly diagnosed type 2 diabetes mellitus, the Verify study, which is a 5-year multi-center randomized double-blind controlled trial. What a perfect trial. Here we have two arms. The previous arm is to start monotherapy with metformin, followed by sequential addition of DB4 inhibitors, which is vildagliptin. The second arm is the early combination of metformin plus vildagliptin. So let us see the results. Here we have targeted newly diagnosed type 2 diabetes mellitus patients with hemoglobin A1c between 6.5 to 7.5. And within 3 weeks, we have upgraded the dose of metformin from 500 milligram per day to 1,000 milligram per day to 1,500 milligrams per day. We have here two arms. We have the placebo, which is metformin monotherapy, 1,000 milligram twice daily, and the second arm, which is vildagliptin here, combined therapy. The first is monotherapy metformin. Here, combined therapy between vildagliptin and metformin. For the first arm, if we have sequential, if we have failure of management or of therapy, which is defined as hemoglobin A1c more than 7% on 2 consecutive sessions, so that this is the primary failure. In this situation, we will add a sequential therapy, vildagliptin. This will be, of course, compared with continuous management from early two therapies, which is vildagliptin combination with metformin. Let us see, this is a 5-year study. Let us see. Our type 2 diabetic patients have enjoyed better glycemic control with this early combination therapy. This early combination therapy have significantly reduced the relative risk of time to initial treatment failure by 49% versus initial monotherapy, which means that this early combined therapy have reduced the failure for management in 50% of our patients. What a great achievement. Let us see when we have compared these type 2 diabetic patients from the start combined therapy and with failure of monotherapy, followed by sequential adding of D4 inhibitors, which is vildagliptin. It is still more effective. Here, the relative risk for time to second treatment failure have been significantly reduced by 26% for, of course, the benefit or for favoring, of course, combined therapy. So that combined therapy was more effective even when compared with sequential therapy adding vildagliptin to metformin by 26%. This is the concept that early combination from the start will achieve, of course, a proper control of hemoglobin A1C and durable, of course, proper control of hemoglobin A1C. So that in our study here, verified study, your patient have 2 extra years of glycemic control. What a great gain with the early combination strategy when compared with, of course, monotherapy with metformin or monotherapy followed by sequential therapy with vildagliptin. This is very important because these 2 years have, of course, overcome the consequences of clinical inertia. Overcoming the clinical inertia, of course, will preserve beta cell function. As you can see here, if we have proper control of hemoglobin A1C from the start, we will preserve beta cells for a longer time. Verified is really a great study because it represents the more diverse type 2 diabetic patients of today. It is a real life study. It included smokers and non-smokers, obese and non-obese patients, hemoglobin A1C, either high or low hemoglobin A1C, with different ethnical diversity. It preserves beta cell function. It is applied to men or women, both gender, and it applied on younger and late onset diabetics. It is a real life patients. It has included 34 countries over 5 continents, including Latin America, Europe, Africa, Australia, and Asia. It has included both men and women. It has included obese and patients, non-obese patients, with the mean body mass index 31 kilogram per square meter and less than 30%, less than patients with body mass index less than 30 kilogram per square meter was 43% of these patients, while the others are the obese. Also, it have included smokers and non-smokers. The smokers here have reached 15% of our population. It includes all ages. It's included with mean age 55 years, but it includes ages starting from 18 years up to more than 70 years. So it have included young ages below 40 and older ages above 40. It even have been included for lower hemoglobin A1C with the mean 6.7 without significant hypoglycemia. So by this study, you will be your patient hero. How can Verify change your patient's life? We can see here 75% of your patients with combined therapy, vildagliptin plus metformin, galvasmet, have achieved hemoglobin A1C less than 6.5% at 3 months. And this was maintained for at least 1 year in compared to 50% for monotherapy. What a great achievement. As we can see here, in this situation, 75% of our patients have achieved within 3 months hemoglobin A1C less than 6.5 and was maintained for about 1 year. Is this important? Yes, because we know previously that strict glycemic control in the first year improves the future type 2 diabetes mellitus outcomes. As we know this, when we have compared risk reduction from hemoglobin A1C levels below 6.5 with hemoglobin A1C between 7 to 8 in first year in a study for 13-year follow-up, very important study. What are the results? with the proper untitled control of A1C, we have reduction in microvascular complications by 39%, reduction in macrovascular complications by 29%, reduction in death and mortality by 29%. As we know that, with progression of type 2 diabetes mellitus, over the time, we have increased complications, which limits therapeutic choice. So proper and early management is the concept of choice. Also, the UKPDS have shown us that 1% drop in hemoglobin A1C will reduce the risk of stroke, fatal and non-fatal, by 12%, myocardial infarction by 14%, microvascular complications by 37%, macrovascular and amputation by 43%, and mortality related to diabetes by 21%. Here, Galvus-Met combination or Velda-Met combination have shown that tight glycemic control over 5 years in 40% of the patients. 40% have achieved tight glycemic control over 5 years when compared with monotherapy in vildagliptin, in metformin, 28%. What a great achievement. Yes, the early combination therapy have achieved tight hemoglobin A1C below than 6.5 within 5 years when compared with the monotherapy group with metformin only. And we can see here more than 50%, 56% over 5 years have achieved a good control of hemoglobin A1C, less than 7% when compared with monotherapy, 38%. What a great achievement. Here, when we are comparing the relative risk of achieving hemoglobin A1C level below 7% at 5 years, all for the favor of the combined Galvus-Met group, related to the level of hemoglobin A1C, the age, body mass index, the sex, smoking, different races, different countries and geographical distribution, and GFR, all in favor of the early combination therapy. Even with the early combination therapy over 5 years, we have mild reduction in body weight, about 1 kilogram, which was comparable with the monotherapy with no significant difference. As we can see, there is no significant difference in the body weight between both groups, so that what a great combination. What about numbers of patients discontinued? They are low and comparable between the two groups, and due to side effects are very low and comparable between the two groups. So this is a safe and durable drug. In both arms, the adverse effects are similar and serious effects are similar, and low, and mortality is very low. And all these cases usually were considered to be related to the study, are not related to the study medications, are related to something else. So that these complications are not due to the medications, this is due to something else. Here, it is a safe drug because there is no increased risk of hypoglycemic events despite low glycemic levels. When we have compared the two groups, we have the same levels of hypoglycemia, comparable levels, and low levels. And even this hypoglycemia mostly is mild with nothing significant. Let us revise the previous concept. The American and European guidelines 2018 have mentioned that while there is some support for initial combination therapy due to the greater initial reduction of hemoglobin A1C than can be provided by metformin alone, there is little evidence that this approach is superior to sequential addition. They are claiming that there is no more support or more benefit when we have start monotherapy than sequential therapy. Let us see. But the newer concepts in diabetes care have been updated for the American and European guidelines. As you can see here, by yellow coloration, the sequential addition of oral agents with metformin has been the standard of care. But the verified study have shown that the early combination between metformin and vildagliptin have made better hemoglobin A1C control and better durability. This is the verified trial, and this was only a privilege only for the vildagliptin. And they are advising that we should consider in the future the combination therapy because it is very, very important to be considered. And here is the new consensus now, the new updates. Whereas previously stated that there was limited evidence for initial combination therapy, vildagliptin efficacy in combination with metformin for early treatment of type 2 diabetes verified trial provides additional information. The initial combination between D4 inhibitor, vildagliptin, and metformin was shown to provide a lower rate of secondary failure of glycemic control, hemoglobin A1C more than 7% versus metformin alone, or even if we have started metformin with sequential adding in the future metformin plus vildagliptin. These results have not been generalized to other oral than vildagliptin. The privilege here only for vildagliptin because this is its trial. Nobody make a trial like this previously. We now suggest that providers should engage in shared decision making around initial combination therapy in new onset cases of type 2 diabetes. So the guidelines are going to be changed. The American European guidelines recommend earlier treatment intensification with a second oral agent if patients have not reached their target after 3 months. Another guidelines, intensifying treatment sooner allows patients to achieve and maintain individual hemoglobin A1C targets. Therapies with complementary mechanisms of action should be used in combining for optimal glycemic control. So early combination, intensification of treatment, and more than one drug to act on several mechanisms. This is very beneficial. This is the new concept now. To have a real conclusion, the UK PDS have proved previously that intensification of therapy will preserve beta cells of pancreas and reduce diabetes complication. Here, the verified studies showed that benefits of early combination therapy with galvasmid and how it affects the durability of glycemic control have been now stated as positions in the diabetes care in the American guidelines, European guidelines 2020 through and being verified and stated in the guidelines. This was verified by verified study, so that we have now a new concept of thinking in our situation. Let us discuss, do young onset diabetes or late onset diabetes benefit more from the early combination therapy? Let us discuss that and see that. Here is the new trial, the sub-analysis of the verified study in the new trial, which have published in June 2020, have shown that early combination therapy delayed treatment escalation in newly diagnosed young onset type 2 diabetes. This is a sub-analysis of the verified study. What a great achievement. Let us discuss the background. Young onset diabetes is an emerging epidemic. 60% of global population are below the 40 years old. The lack of long-term efficacy and safety data of pharmacological intervention may contribute towards the delayed treatment initiation and intensification. Previously, nothing was insisted for early control and intensifying control in these patients. The recruitment of newly diagnosed treatment-naive patients with type 2 diabetes from 18 to 70 years in the verified trial enabled us to evaluate the early combination therapy compared with the metformin monotherapy among patients with type 2 diabetes diagnosed before and after the young onset diabetes mellitus and the late onset diabetes mellitus, and here the cutoff point is the age of 40 years. The objective here to evaluate the efficacy and safety of vildagliptin plus metformin combination approach in patients with young onset diabetes mellitus versus those with late onset diabetes mellitus. What is the primary endpoint? Time to initial treatment. Primary, defined as hemoglobin A1C 7% or higher at 2 consecutive scheduled visits after randomization in both young onset diabetes and late onset diabetes patients, either on only combination or on monotherapy. What is the secondary point? The secondary point failure. Here we compare in both groups. Here, if secondary failure after sequential addition of course, vildagliptin or D4 inhibitor vildagliptin to monotherapy. Let us see the results for primary endpoint. In young onset diabetes mellitus, the early combination have improved hemoglobin A1C in 48% when compared in late onset diabetics to 46%. What a great achievement. Let us see the results for secondary endpoint. Here, of course, when compared the two groups, we'll find that the early combination therapy from the start rather than sequential will improve hemoglobin A1C in young onset diabetes less than 48% when compared to late onset diabetes 24%. What a great benefit for nearly the double. What a great benefit for young onset diabetes mellitus for the secondary endpoint. What a great benefit. It is doubling of the incidence. So that Conclusion, in patients newly diagnosed with young onset diabetes and with hemoglobin A1C of 6.5 to 7.5%, the verified study showed that early combination strategy of vildagliptin plus metformin improved the attainment of glycemic targets with durability and delayed treatment escalation compared with sequential treatment of metformin followed by additional vildagliptin. This is now the new concept, that the early combination vildagliptin plus metformin galvasmet here very, very important to delay escalation of this treatment for better hemoglobin A1C and better durability for hemoglobin A1C. Let us see here the concept of this process. What do patients with diabetes want from their treatment? They are usually afraid from hyper or hypoglycemic events, frustration, fatigue. So that with combination, they are expecting lower risk of hypoglycemia with no fluctuation. They are afraid from late macro and microvascular complications with make anxiety. Here, at this consensus, we will have a tight control of hemoglobin A1C below the 6.5, and of course, prevention of primary and secondary failure for a longer time, may reach up to 5 years, so that this is very important. Lifestyle restrictions and reduced quality of life with monotherapy, leading at the end loss of control, but this will give him more space for more eating and more convenient life. So I want to live a long and happy life. So that start with vildagliptin galvasmet for newly diagnosed and uncontrolled patients because it offers durable hemoglobin A1C over 5 years and starts early within 6 months. Consistently lower hemoglobin A1C level, particularly in the first year, which is critical for future outcomes versus monotherapy. Comparable tolerability with no increased risk of hypoglycemia or weight gain or other side effects. So that vildagliptin metformin offers a new treatment approach for early type 2 diabetes mellitus and a better future, so that our future is saved, our future is verified. This was verified by verified